All right, we'll go ahead and get started. Good evening and welcome to another Spotlight PA live event hosted by Spotlight PA and our wonderful partners in Pittsburgh, WESA Public Radio. We're also very excited to be joined tonight by one of our alums, Aneri Patani, who is an investigative health reporter for us here in Pennsylvania. Before moving on to KHN News, so a very special welcome back to Aneri. Following the money is one of the core duties of investigative reporters, and I'm so excited you've joined us tonight with some real experts in the field about how to track the coming opioid settlement money, upwards of $1 billion. That's billion with a B, and to hear more about the debate on how it should be used. So I'm so glad to see everyone here tonight. Before we get going, those of you who are new to our program, Spotlight PA is an independent, nonpartisan, nonprofit newsroom producing investigative and public service journalism about the state government and urgent statewide issues. We make all of our vital reporting available to the public at no cost through our website, spotlightpa.org, and our many free email newsletters, which you can sign up for there, as well as by sharing it with 95 community newsroom partners who republish our work all across the state. And we can only do that because of your support. Tonight, we're at a pivotal moment. We have 8 days left in our spring member drive. We have about $18,000 more to raise to hit our goal and keep our work going strong. As a special bonus, every single gift tonight will be matched dollar for dollar. That means your gift right now will be doubled. Please take a moment and go to spotlightpa.org/donate and make a gift. That's spotlightpa.org/donate. While you do that or consider doing that, I want to pause here just to emphasize why this model of public access to journalism is so important to us. In January, a woman reached out to me to tell me that she couldn't support Spotlight PA again this year. She had given $5 last year, a very small amount, but all she could muster. And this year, she wrote to me, she just couldn't afford it. Access to vital information, the facts you need to cast an informed vote or hold your elected officials accountable or get involved in your community should not depend on what you can afford. I mean, should that reader, that woman who emailed me in January, have lost access to our work just because she could no longer afford to contribute this year? We believe the answer to that is absolutely not. That's why we don't charge a subscription fee or have a paywall, but we do depend on the generous support of those who do have the means to allow us to continue this public service. So I'm going to ask one more time for folks to please go to spotlightpa.org/donate now and make a gift. Once again, every dollar you give tonight will be doubled. If you're already a member and you're here joining us this evening, thank you so much. We're really happy to see you and we appreciate you making this programming possible. And if you're in the Pittsburgh area and you listen to WESA, please consider supporting their work as well. It's really quite excellent. A few housekeeping items. We are recording today's event for those of you who couldn't make it. Obviously, if you're here, you made it, but if you're not here, we're going to record this event for them. You can view the event tomorrow on our website, and we'll let you know when that's live. If you have a question for our panelists, you can drop that right here in the Q&A feature in Zoom. If you just go to the bottom toolbar, click Q&A and drop your question there, we'll get to as many of those as possible. And with that, I'm going to hand it over to Ed Madden to kick things off. Ed?
Thanks so much, Chris. I appreciate it. Thank you all so much for being here. The opioid epidemic has had a devastating impact on so many people in Pennsylvania, and it continues to kill thousands of people each year here. So there is now a lot of money coming to the state that's supposed to help us respond to this crisis. Josh Shapiro, the state's former attorney general and current governor, has said more than $1 billion in opioid settlement money is, quote, earmarked to offer and expand life-saving treatment options, end quote. But in our reporting, we found that potential uses are much broader than that. And there are already debates happening over whether that money can and should be spent on things like drug task forces, detectives, and even guns. The spending decisions happening now could have an impact for years to come. So we've got a great group of guests to help us understand what's at stake with this money and how you can help influence the process. We have a bunch of questions for them, and please drop your own questions into the Q&A, as Chris mentioned. My colleague, Kate G. Marisi of public media station WESA in Pittsburgh, will be introducing our panelists. Kate, over to you.
Thank you, Ed. So our panelists this evening are Jordan Scott, regional field organizer with the PA Harm Reduction Network. Her organization seeks to end overdose deaths, drug use related incarceration, the spread of HIV, and many other harms related to drug use. We also have Aneri Patani, senior correspondent with KFF Health News. She reports on a broad range of public health topics, focusing on mental health and substance use. Alejandro Alves, technical director of the Overdose Prevention Program for Vital Strategies. His organization is a global public health nonprofit that works in more than 70 countries. And we also have Jason Snyder, director of the Behavioral Health Division and policy director of Substance Use Disorder Treatment Services for the Rehabilitation and Community Providers Association. He's responsible for leading provider members to influence policy, regulations, and legislation to help those they serve in need of treatment. And for our first question, I'd like to go to Jordan. Jordan, Pennsylvania has been experiencing this opioid epidemic for a number of years now. Can you kind of give us an overview on where things stand and how do we compare to sort of where we were a few years ago?
Yeah, of course. I think starting off to point out that we are in a situation in Pennsylvania that we haven't ever been in before. We've never had a drug supply that is so toxic and is evolving rapidly. Whether we're talking about the emergence of different fentanyl analogs or adulterants like xylazine, we have really surpassed it being an opioid epidemic or an overdose crisis, and it's a public health crisis. And Pennsylvania has always been the epicenter for drug trends and the evolution of the drug supply. But we are light years behind where we should be in order to actually effectively address this issue.
Thank you. And Aneri, could you kind of give us a big picture view on how much money are we talking about from all these various opioid settlement lawsuits?
Yeah, so for Pennsylvania, as I think a few folks have mentioned, the total in opioid settlement funds right now is a little over 1.5 billion coming out over 18 years. If you zoom out nationally, we're looking at 54 billion being paid out to all the different states and local governments from now till 2038. And that's coming from a lot of different companies, Purdue Pharma, AmerisourceBergen, CVS, Walmart, several others. And then there's a possibility that more could be coming because there are still some companies that are in early stages of litigation, places like Kroger or Indivior. So that pot could grow, but right now we're talking about 54 billion nationally.
And so I want to talk to Jordan, Alejandro, and Jason. Just, how do you want to see PA spend this settlement money? And, what brought you to this decision? Jordan, if you can start out, and then Alejandro, and then Jason.
I mean, as a whole, this money needs to go directly to the community. It needs to go directly to people who use drugs, who have been the most impacted by this issue. It needs to go to the family members and community members that have been affected. I mean, you look at certain communities in Pennsylvania and they've been ravaged for years now. And there's been so much devastation. And they, more than anybody else, know exactly what this money is needed for. Because there can't be this broad state plan because every community in Pennsylvania is unique. Solutions that would work in Philadelphia are not going to translate to a community in, say, Franklin County or Northampton County because they're completely different and they all have their unique needs. So therefore, those directly impacted should be making all of these decisions. And I would love, this is such a unique opportunity with so much money to embrace all these evidence-based measures that we know work, whether we're talking syringe service programs or broad zero barrier access to medications like buprenorphine and methadone that are, the gold standard for treating opioid use disorder. That's really where we should start, because as I mentioned, like the drug supply right now is so toxic. Like we need to rapidly contain it if we're ever going to get a handle on this.
Yeah, and then Alejandro, what's your view about how this money should be spent?
Absolutely. And I will, a bit tongue in cheek will say, spend it on what works. And I say that because we're really in a field that has an abundance of research, frankly, on what does save lives and on what does create more damage and harm to communities. And so as our organization promotes sort of three areas of spending for any source of funding, really not just for settlement, but really it's, as Jordan said, making methadone and buprenorphine truly accessible, without barriers, without hoops to jump through, without having to prove your sort of moral worth to be able to receive those treatments, and just no barriers. We promote community-based harm reduction, putting funding into the hands of the services and the people at that level that are doing the work, that have been doing the work for years to save lives through services like syringe access, like drug checking programs, and through supportive services. And really ending the punitive approaches and the coercive approaches that have been the sort of prevailing history of drug policy in the United States. So moving away from enforcement, moving away from incarceration, and more than that, which I can talk about later when we talk about that, but thinking about what is support versus what is coercion in our systems. And then finally doing all of that in a way that directly head-on addresses inequalities and disparities in the work, not as an afterthought and not as a sort of underlying thing, but that really thinks about how did we arrive at the deep disparities that we see today, the racially driven disparities, and recognizing that some of those disparities are not an accident, that they are intended consequences of the systems that are in place today. And so really addressing like the removal of those systems and replacement with something better.
I appreciate that. And Jason, you represent a lot of addiction treatment providers in Pennsylvania. If you talk about your view about how this money should be spent?
Sure. Well, first, let me say, if you listen to the negotiators of the deal, as you mentioned in your intro, Ed, we hear things like expand access to life-saving treatment options. We hear other negotiators of the deal talk about enabling programs and services that will allow people to be alive for years to come. We talk about the ability for individuals and families to begin rebuilding and dealing with the damage that this epidemic, fueled by pharma in large part, has done. And so this really, in our opinion, is the spirit of the settlement: remediation. I think all of us here can agree, including some of those who aren't represented on this panel today, recovery community organizations, the recovery community, that this money through treatment, harm reduction, prevention, recovery support will help to achieve those ends that the negotiators outlined when they negotiated the deal. We have a real chance here, a real opportunity to make a great difference with this amount of money, but we also are at real risk to add to the harm and damage already done if we don't do it right. If after hundreds of millions of dollars are poured into the Commonwealth of Pennsylvania, we're still seeing high numbers of deaths, we're not seeing people get into recovery, we're not seeing sustained recovery, we are going to do a real disservice to those people who need our services, because people will look and say they can't get better, they can't be helped. So we have a chance to really get this right, and we have to do it. How would we like to see the money spent? Certainly, we would agree with what has already been discussed, but from our perspective, again, as providers of treatment services, program expansion within the current system, absolutely, to include low or no barrier, I would say low barrier access to medication to assist in treatment of opioid addiction, whether that be in rural Pennsylvania, whether that be in urban areas. Look, we need higher levels of care, especially with the adulterants in the drug supply, xylazine. We see people in need of much higher levels of care, especially because of the physical components of this, what xylazine is doing to them, as we all know, in terms of wounds, et cetera. We need higher levels of care. We don't have enough providers who can not only treat the addiction, but also the physical health a piece of this, what we're seeing from the xylazine. So we need expansion of treatments. We need to fund recovery support organizations and recovery support in general. And we need to look at transportation as well. We know that's a big barrier across the Commonwealth of Pennsylvania. And I would lastly say we need to do this with an eye towards sustainability. We have a workforce crisis right now, and we hear a lot of people talking about standing up new programs. We are struggling right now to treat those who want it and need it because of the dearth of clinicians available. And so we need to be smart when we look at how we're going to expand access within the existing infrastructure.
I appreciate that. I appreciate all those perspectives. One thing we talked, Kate and I looked into in our reporting is we found some counties are looking to spend this on law enforcement, specifically drug task forces, specifically more opioid detectives to investigate opioid cases. The argument some county officials who are looking to use these funds for those reasons make is that they say law enforcement can help prevent drugs from entering a community. What do you all make of that argument? I'll start with Jordan, Alejandro, and then Jason.
I mean, I'll start with that approach hasn't worked in the history of ever. That's the approach we've taken for the last 50 years is law enforcement and, further criminalization, probative policies, and it's not effective. If anything, that is exactly what is fueling the evolving drug supply. It's because of that criminalization that we saw the transition from prescription opioids to heroin and then fentanyl and now analogs and, adulterants like xylazine. And to be honest, our, government played a huge role in what happened with pharma. We have to acknowledge that pharma was not, they did not act alone. Our government opened up the door for that to happen. And again, it doesn't work. If we looked at spending the money on actual community improvement, like what if we brought back community centers? What if we brought back after school programming? What if people could have, more than just a livable wage and affordable housing and equitable access to food? Those are all the things that contribute to this crisis, but we just want to arrest. And then everybody sits around like, well, why didn't that work? Well, why would it?
Yeah, Alejandro?
Yeah, I agree with everything that Jordan said. The theory that enforcement can keep drugs out of a place or can stop people from using drugs has been tested and disproven over generations. I mean, there's never been any demonstration that can work anywhere in the world, I would say. It's really about how do you change that system? How do you recognize why that system was built to begin with? And the roots of drug policy in this country being based in really xenophobia and racism and designed to create harm, and just turn that upside down. But even beyond the discussion about enforcement and policing, I mean, I go broader and I talk about support versus coercion. And you sometimes hear in discussions, well, maybe not policing, but we will do police involved diversion programs where you sort of force a person to treatment. And I would say, anything that is coercion is going to get you the same result. Anything that looks and feels like a go to treatment because you're threatened by arrest and might be, feel softer and kinder because you're not incarcerating somebody, but you're forcing them to treatment. Anything that looks like a civil commitment or a mandated treatment, those things are absent of evidence. I mean, the only things that have been shown to work are, as I mentioned before, it's supportive services for people who use drugs. It is acceptance of the fact that they will use drugs and thinking about not how to stop them from doing that, but how to make them safer, allow them to be safer, even how to stop creating harm. And it is creating access to the medications that are the primary ways to reduce risk of death, which are buprenorphine and methadone as treatment and naloxone as life-saving access. So I would say, definitively that our orientation is to stop the punitive systems and stop the coercive systems that are in place today, and invest in something new. I mean, part of the what's exciting about the settlement funding, which is relatively, smaller order when you compare them to federal funding sources like CMS, like stamps of block grants, like SOR in total, but the settlement funds come with this ability to fund things that you may not have been able to fund before at the local level because of restrictions that come on federal funding. So really try things that have not been tried before in the United States, but that have been shown to work in plenty of other places.
And Jason, do you want to weigh in on this, and then I'll hand it to Kate to.
Just briefly, I mean, certainly agree that the best predictor of the future is the past. Just had a conversation with someone very recently about that. And of course, as Jordan and Alejandro have said previously, it has not worked. Now, we do believe that law enforcement could play a role here. We do believe that law enforcement could be a bridge. I'm not talking necessarily about coercion, but I am talking about voluntary diversion programs, training for law enforcement for crisis situations to enable them to better respond to and react to these types of situations when they're called on. But absolutely, do not support using these opioid settlement dollars for what I would call classic policing. And so we do see a place for law enforcement, not necessarily with these opioid settlement dollars, but if we are going to go in that direction, that's the way we would prefer to see it.
Aneri, can you talk a little about what can the settlement funds, what can they be used for and what can they not be used for?
Sure thing. So most of the settlement agreements say that 85% of the money that any state receives has to be spent on, quote, opioid remediation. And essentially that term means things related to addressing the opioid crisis. So prevention programs, treatment, recovery supports, harm reduction. And then the settlement also has a list attached to it called Exhibit E of about 100 different potential uses. And they really vary. Things like paying for addiction treatment for people who don't have insurance, building recovery housing, starting addiction prevention programming in schools, buying naloxone. But the key is that list is non-exhaustive. So that means governments can choose to do things that are not on that list as well. And that's where there are sometimes broad interpretations of the term opioid remediation. And that's where a lot of the conversation that crops up about, does funding for law enforcement initiatives fall under opioid remediation? Does funding for housing or, community centers that Jordan was talking about, do those fall under opioid remediation? So those are the conversations we're seeing play out in Pennsylvania and across the country.
And can you speak to, are there any sort of like best practices that have been put forward about how to spend the funds?
Yeah, a ton of groups have come out with recommendations on this. So, Johns Hopkins has created principles for how government officials should approach the money and plan for its use. The National Association of Counties has a bunch of short documents advising on different strategies that counties might want to use. There's the Duke Margolis Center that's created tools like data tools to help counties think about this. So there's a lot of different tools out there. Those are just a few. But some of the things that are common that they all emphasize is, one, paying attention to research and what's shown to be effective or ineffective, which I think we've heard a lot about tonight. Two, thinking strategically about what is already funded with federal or state dollars, because there is already a lot of money dedicated to the opioid crisis. So thinking about where that money is being used and what settlement funds could do differently or to add to that. And then the third thing a lot of these recommendations emphasize is speaking with folks who are affected by the crisis to understand what the gaps are and what they need.
And then, so in Pennsylvania, a lot of money coming in. Jason, how difficult or easy has it been to track how that money is being spent here?
Well, certainly there's been no ease, Ed. Mostly anecdotal. you might read a story out of a local daily paper or on the internet. That's really the extent of what we've been able to find out. Our providers in counties in which they provide services oftentimes can't even tell us what the counties are doing with the money. So there really is very little transparency. It's a very opaque process. And Jordan talked about individualized to counties versus a broad-based state plan, and I agree in part. Of course, that's how this is going to have to be, because we have 67 counties that will find 67 different ways of doing things, and therein lies one of the biggest challenges for advocates. There is no one, well, there may be, but very difficult to track this more globally, if you will, because of that, because there really, as we understand it, at this point, no real reporting requirements being mandated, no central repository where any individual can go and learn how each county is distributing the funds. How are they making the decision to distribute the funds? Who's getting the funds? What are they doing with them? I mean, very difficult to get any of that information. And really that is inherent in the way the money is being distributed. 70% to the counties, 67 ways of doing things. I do believe there is a solution. We can talk more about that at the end, but to answer your question, very difficult to track this.
Yeah, and yeah, as we've been reporting on it, there was supposed to be these reports filed in March. The opioid oversight trust for this money, they waived that requirement for this year, for 2022. So that deadline is now pushed back till next year. So right now, a lot of this oversight is going to have to be up to individuals at the local level to get a sense of this. And there, you've written about problems with transparency around this money and problems with oversight across the country. What are those problems, and can you tell us about the experiences in Ohio and elsewhere?
Yeah, I think some of the confusion, opacity, frustration that Jason just talked about is happening across the country. A lot of people want to know where this money is going and how it's being used, but they're running into a number of issues. So one of the big ones is that the settlements just nationally have very few requirements for governments to report how they spend the money. The only requirement is that states report when they use money for purposes other than opioid remediation. So if they use it for something not related to the crisis, they're supposed to report it. But that is also on an honor system. So if a state doesn't submit a report, then the settlement administrator is just supposed to assume that the state used all of its money on the opioid crisis. States have the ability to enact stricter reporting requirements, but my colleagues and I did sort of a 50-state analysis on that and found only 12 states have really committed somewhere in their laws to, or executive orders or some sort of legal document. Only 12 states have committed to detailed public reporting of all of their spending. So the vast majority are not doing this, or at least are not committing to doing it yet. And then you talk about Ohio. What we see there is also happening in a lot of states where the councils that are making decisions about these funds are not operating very openly. So sometimes their meetings are not open to the public, they're not announced in advance. Even if they allow the public to come, there's not public comment period, so people can come, but they can't voice concerns or weigh in. Sometimes the councils won't share their documents publicly. So in Ohio, a harm reduction group actually sued the foundation that's overseeing a lot of their settlement funds for this kind of opaque behavior. And courts there have recently ruled that the foundation does have to be more transparent, that it has to hold public meetings, and that it has to respond to public records requests. So that's sort of been an update in Ohio, but the concerns there are still happening in a lot of other states where people say, this money is here to address public harm, and the public wants opportunities to weigh in and be part of that conversation and track where it's going. But as of now, that's really hard to do in most parts of the country.
And along those lines, Jordan, can you talk a little bit about your experience getting information from the state and from various county governments about how they're spending these funds?
Yeah, of course. Honestly, I'd have an easier time herding cats than trying to get information. I mean, from the beginning, it's a lot of we'll throw you a bone to make you happy, right? So if you look on the website, there were multiple meetings in 2022. I don't believe those meetings were recorded. If they were, the videos aren't on the site. The minutes have been. The first meeting that was actually announced for March 30th, they satisfied the public notice requirement by posting a notice in a local Harrisburg paper that is behind a paywall and posting it on the bulletin board that is directly outside of CCAP's office. So if you don't subscribe to that Harrisburg newspaper and you don't frequent CCAP's administrative building, which I don't think anybody besides CCAP employees do that, there was no way of knowing about that meeting. But again, there's so much gray area that, that still technically meets that requirement. And it's not enough. Like there should be, it shouldn't be pulling teeth to find out how this money is being spent, not as a state resident, not as a constituent, and certainly not as somebody directly impacted by the public health crisis. Like I don't know about all the members of the Opioid Trust, but I am a drug user and I've been burying my friends since I was 16. So we're going on 30 years. Sorry, no, 20 years. My math is off, but 2 decades of losing people to preventable overdoses. So it gets me a little worked up. And in a time where there is such a lack of trust in government, they should be embracing transparency. And they're not.
And along those lines, you mentioned the Opioid Trust. It's the 13-member board that has oversight about how the counties spend this money. And the trust does not allow public comments at their board meetings, which you've criticized that before. And I guess why is it important for members of the public to be able to speak at those meetings?
I mean, frankly, because it's our money. It's not theirs. And there isn't a single person serving on that trust that has been directly impacted. And I mean directly impacted. We have a wide array of very experienced public health professionals across Pennsylvania who are not serving on that trust, and they should be. And just going back to, it's our money. It is the victim's money. And, in the almost 10 years that I've been involved in this field in some capacity or another, I have seen millions of dollars misappropriated around the state, millions, and there's never any recourse. And when you try to figure out who's responsible for that money, everybody just points fingers at each other. So I have zero faith in the trust and in the SCAs to appropriately distribute these funds. And I'm not alone in saying that, because I've spent the last probably almost year talking to people around the state, and that's the general consensus of most people.
So a question for all our panelists. If there's people listening who want to know what is happening in their county and what their local officials are doing, I guess what's the best way for folks to kind of try and track that and to influence these decisions in their own counties? And I'll start with Jason.
Well, I mean, you can start by asking some of the county leadership, county commissioners. You can talk to the elected officials in your district within your county. But I think that as Jordan described, can be a frustrating ask, and you're oftentimes not going to get perhaps all the information that you want. Frankly, I see a real need possibly for a legislative solution, and Neri mentioned this. the only way I really see 67 counties being forced to be transparent on this is with a piece of legislation, with a law that would force them to do that. We've had some conversations with the Attorney General's office several months ago, and we raised some of these issues, and we've had good conversations with them and assurances that these types of things are coming, and I hope that they are on their way. But look, we're getting down this path now. We need transparency, and really, I would say a legislative solution may be the way to go. A law that would force a central repository for each county to report how they're distributing the money, how they're making the decisions to distribute, who's getting it, what's being done with it. Last thing I would say, Kate, is again, I think we can all agree, the panelists on here, that this money is best used in harm reduction, low barrier access, alcohol, low barrier access to medication and other effective treatment programs, not policing as it's being described. And the thing I would suggest is we're much stronger together as a coalition of organizations that are like-minded in many ways. And so I would suggest as well that from this point forward, because we have common ground, we're going to be much stronger together, potentially moving to a legislative solution if necessary.
Any other panelists want to weigh in on what people can do to kind of learn more about what their county's doing?
I'll just, kind of springboard off a lot of what Jason mentioned, but, your county commissioner meetings are open to the public. Attend them because they do have public comment. Your city council meetings are open to the public and they have public comment. Writing op-eds in your local newspaper, government officials get really antsy when there's, bad media attention on them. Call and ask questions, be loud, be persistent. If you say you're in Franklin County, if you can mobilize 30 of your community members in Franklin County to show up to the next county commissioners meeting, it's very hard to dismiss 30 people, whereas it's easy to dismiss one person. I'm of the thought of, if they're not going to be transparent, if they're not going to be accountable, then we demand it and we take it. Because otherwise this is just going to be the tobacco settlement 2.0.
Could I
I'm also all for, if anybody wants to do a statewide watchdog committee, Barnes ready.
I just wanted to mention a few resources that folks might be able to use, and I'm happy to drop these links in the chat once I say them. But one is opioidsettlementtracker.com, which is a website put together by an attorney out in Washington, state of Washington. But it has good information at the state level about which settlements each state is participating in, what legal documents they have so far, how they plan to split up the money between local and state governments. Then there's a group called Community Education Group that has a spreadsheet where they are tracking those county commissioner meetings that Jordan mentioned. They are tracking those meetings, the meeting minutes, and flagging when the meeting minutes discuss opioid settlement funds. So if you missed previous meetings, you can look into their spreadsheet for your county. They're only doing it for Appalachian counties, but that will include, of course, some Pennsylvania counties. And you can see when your county discussed this, what they said about it. They'll link to the meeting minutes. And then the third resource I wanted to mention is, as I said, the only national reporting requirement is for states and local governments to report when they use money for something that is not related to the opioid crisis. And those reports are actually publicly available on a site, so you can go and see if your state or county or city has submitted a report, and it will simply say the amount. It doesn't actually tell you what they used it on, but someone signs off on that report. So that person's name and signature is there, and you can reach out to them and ask, I see X amount of money from the opioid settlement was spent on non-opioid purposes. Can you explain to me what that was used for? And as a journalist, I have done that, and I encourage others to do that as well.
I'd echo that, and Neri, thanks for mentioning some of those resources. Vital Strategies, we're actually working with opioidsettlementtracker.com and the folks there. The process for decision making in every state varies, ever so slightly, and so we are going to be putting out some basic resources to describe what that is in each of the states. And so if your state has a commission, for example, who's appointed to that commission? How can you get in touch with them? Where are they going to post their meeting minutes? So that will be available in the next few weeks for each of the 50 states. But I think, as other panelists have described, this is going to be sort of, classic American local government. It's going to be your involvement, speaking up. I would go even further in a lot of places. I know largely this audience might be Pennsylvania, but across the country, there are boards and commissions and advisories being set up that are not filled yet. So, even do more than speak up, put yourself forward, or get involved and demand that local advisory or commission include people who use drugs or who have used drugs or who have been impacted by drug use, so that it's not just voices of officials, but it's actually from the community that's being impacted. Or volunteer yourself to be a member of those local boards that may still be remaining to be established or filled.
That's all some really great advice and very helpful. We have some audience questions now. So I might call on you, or you can raise your hand if you want to take this one. But question from the audience: why is the money not going to families who suffered? And Neri, I don't know if you can speak to that.
Yeah, so this is a product of the legal system. A lot of early lawsuits were filed by families, people who lost loved ones, but trying to hold companies accountable for an individual's death is very hard in the legal system to show that liability. And so a lot of those lawsuits just didn't go through. But when governments sued, when a state or a city sued saying the pharmaceutical companies put out this product and lied about how addictive it was, and it created a public nuisance, that was a lot easier for the cases to go through and for the companies to want to settle. So what happened is the settlements that we have are between the companies and state governments, and so the money is going directly that way as opposed to going directly to people who were harmed. There are a few, the Purdue Pharma bankruptcy, whenever that is finalized, will include some payments to individuals. The Mallinckrodt bankruptcy will include some payments to individual, but by and large, most of this money is going to the state government level because those were the cases that were most successful.
All right. And then again, for everybody in the audience, you can drop questions in the Q&A format. You should see it at the bottom of your Zoom link there. And we have a lot of great questions. We got a lot of great questions about incarceration and treatment for people in jail or coming out of jail. So can some of the panelists talk about thoughts on how we can use these funds for those in and getting out of prison? And the other question was about why aren't more counties giving money for medical treatment such as methadone or Suboxone to those incarcerated who need it? Do we have any idea how many counties are prioritizing this? Alejandro, maybe Jordan, yeah, Jason, if you want to weigh in on that.
Yeah, I can jump in. I mean, the question about helping people who are going into or out of prison. I mean, first of all, baseline answer I will say is don't send them to prison or to jail to begin with, simply for having used a drug. We need to just get out of that framework of having that response of sending a person into incarceration and really think about, providing a supportive system. That said, that is a dream, but today's system does send a lot of people to incarceration. And so we need to realize we're putting people into these facilities and then offering them nothing in terms of treatment. You're putting them into a system that creates massively increased risk of death upon release. Various studies have shown between 40 to 130 times greater risk of overdose after release. So we need to talk about getting methadone and buprenorphine into those facilities, having systems that help people get them on treatment before they're out, that provide naloxone. And then I think even further, the system of incarceration reaches further than just this facility. People come out and they are remain under criminal justice supervision, and will often go back into incarceration again for nothing more than using a drug again, not for committing a violent crime or any other sort of risk or damage to society, but just for their own choice to use a drug. And we're sending those people back into incarceration. So thinking about what are the better ways to respond to that for people who may be already out of prison or jail, but are still on probation. And do probation systems really need to respond the way that they do today to simple violations like that?
Ed, if I might add, when we talk about treatment behind the walls and buprenorphine and methadone, I will say that it's much easier for the state prison system to implement these types of programs than it is for the county-based system. Again, it comes back to this idea of each county operating in its own individual way. If we look at Pennsylvania state prison system, I would call it a fairly robust buprenorphine program. Certainly, could it use additional funding? Absolutely. But I will say that at least at the state level, the Department of Corrections has moved in that direction. Methadone is another story. And part of the problem with methadone is how regulated it is. Federal regulations, both Jordan and Alejandro talked about improving access to methadone, for example. It is so heavily regulated, both from a federal and state level, that it makes it very difficult for those systems, whether it be county or state, to provide it. All of that said, there are still ways to do it. There are still providers who are working with county jails in Pennsylvania to make it happen. But if you were to look at and learn about the details of how those programs are working, it's a wonder that any provider would want to do it, because it is so arduous and so burdensome to be able to take methadone from a licensed opioid treatment program into a county jail, and really cost prohibitive for the provider, given all of the hurdles and hoops that they have to jump through, that it's very difficult. But I would also say that the county jail system has a long way to go to being willing and open-minded when it comes to treating those who need treated behind the walls. A lot of complications, but we have a long way to go when we talk about stigma within the criminal justice system, especially when it comes to medication.
Yeah, I'll just briefly echo. I mean, other than we could just not incarcerate everybody that uses drugs. But, I worked very closely with problem-solving courts in Pennsylvania for 5 years in county prisons. And a lot of it comes down to how people who use drugs are perceived. Typically, once you become incarcerated, you're not viewed as a person anymore. You're not viewed as somebody with rights anymore. So we talk about supporting people that are going in and out of prison. It starts with changing the culture. It starts with, we stop stripping people of their humanity. We need to make sure that people are released from prison with their medications. I can't tell you how many times I had somebody released from prison without their medication. And also looking at, realistically, your average probation officer and parole officer cannot effectively manage their caseload, not when they have over 100 people that they are supervising. My cousin a year ago sat in a county morgue unclaimed for 2 months, and her probation officer didn't even know she was missing. Utilizing community supports like peer support in place of supervision. I've seen the power of community case management and peer support in helping stop that cycle of reoffending and going back to prison, and taking that burden off of probation officers and parole officers, because they're not case managers and they're not peer specialists.
We have a submitted question from Kelly in Washington County, who is a member of the Washington County Overdose Coalition. She asks, has any consideration been given to allocating dollars for the education of addiction professionals? And how can the dollars be used to reach more aspiring SUD professionals to create a more diverse workforce? Jason, I'm going to put you on the spot first, but then other people feel free to jump in after. And I will also say that this workforce issue came up a lot as Ed and I have been reporting.
Absolutely. Look, the money could absolutely be used in any of the ways that you just asked about, Kate. That I think is the heart of what we're discussing here. Will it be used in that way, and can we influence the counties to do it? But as I mentioned earlier, and as you just said, Kate, we need to be looking at robust workforce development programming. This money would have been a perfect opportunity to do that, at least in part, to put a pot of money together to really create a sustainable workforce into the future that would include educating potential clinicians and counselors who are considering coming into the workforce. We could use this money to destigmatize the type of work that we do within the treatment system. So really, we can do anything within that education realm. It's do the individual counties, do they agree, and will they do it? But there's no question that if we don't address workforce, especially from a treatment perspective, the very system that we have is in jeopardy right now. And look, we can go a lot of different ways with this. Not only can we not hire, we can't pay. And so we're losing staff to higher paying jobs. This money would be a great opportunity to create a long-term workforce development plan. Very difficult to do, though, broadly when you have 67 counties doing, their own thing with it. So yes, the money could be used in that way. I suspect there are some counties talking about that, but without some type of central repository, it's anyone's guess whether it's happening.
And other question we got is from Maxwell asking about what can we do to ensure these funds address the undeniable discrimination in healthcare, discrimination which exists even at the fundamental level of asking what healthy is and is not, and noting which marginalized groups remain barred from helping make the determination. Again, we've got 67 counties in Pennsylvania making these decisions. So, Alejandro, first, your perspective on that issue about equity and how these funds are used.
Yeah, I mean that's so tough to capture briefly, but I think it starts with really recognizing that a lot of today's systems were built to create exactly this result, right? We haven't arrived at inequities, particularly when we talk about racial inequities. We haven't arrived here by accident. We've arrived here because the systems were created to do just that. And so, what are we changing? What are we doing differently that isn't just relying on the same systems and doubling down and doing that harder, right? I mean, we talk a lot about incarceration and finding alternatives that are non-coercive to incarceration. That really requires an admission that the system of incarceration was created to oppress certain people in this country, and it's doing exactly that. We talk a lot about low barrier access to treatments because there's a recognition, I think, that the barriers that were put in place are sort of there to make a person prove their worth, in essence, which is very lightly coded language for a way to create racial inequity. So I think you really have to question what system you're investing in and what system you're thinking about just completely dismantling and approaching in a different way. So it's not something that happens as a sort of side effect of some other reform. It really has to be done as intentionally as possible. And I would also say that data at the local level is super critical. Identify locally by race demographic, by gender demographic, by other indicators that will show you something about communities that are marginalized in your own regions. People who are from the LGBTQ communities are massively oppressed and suffering at a much greater rate. People that are indigenous are suffering at a much greater rate from this crisis. And if we don't have the systems of data to show you that in your community, you're never going to be able to address that question.
Yeah, I think I'll just add, just to piggyback off of what Alejandro said. The system's doing exactly what it was designed to do. So it's not broken. It's working exactly the way it was meant to. It overall, there's a very widespread lack of just basic empathy and compassion towards people. You know, I have seen the best of our treatment and healthcare system, and I have seen the worst of it. And I can confidently say, if I was to need treatment right now, I don't know if I would go as a drug user, because of the stigma, right? And we do not need another $2 million study on stigma, for the love of everything holy. We have researched stigma exhaustively. Now what we need is actually a concrete plan. And this can sound harsh, but I think we're reaching a point where people that work in this field, if you cannot get on board with being empathetic and showing basic compassion to another human being, then it's time for you to go. It's time for you to find a different line of work, because those opinions that aren't rooted in science are literally killing people. There's a reason why people with, wounds and complications from xylazine and fentanyl are not seeking medical care. It's not because they don't want their wounds treated. It's because they know if they walk into the hospital, they're going to be treated worse than the gum on the bottom of somebody's shoe. They are treated at an animal level. And that's an issue that we don't talk about enough.
Thanks for saying that, Jordan. I just want to build on that a little bit. I mean, people not seeking care because they're afraid of systems is so real and so true. And so much of it is related to drug policy and drug use. I mean, we see, Black and Indigenous people who are afraid to seek, prenatal care, for example, who are putting their pregnancies and their children at risk because they know that, these systems will treat them in a certain way and will tend to want to separate a family rather than help a family. And that manifests in so many aspects of our health systems beyond just drug use. I mean, it's really seeped out to affect everything. And so again, it's every time that we're asking somebody to prove themselves or to jump through a hoop, really asking why is that hoop there, and was it put there to hurt a specific group of people? A lot of times that answer is yes, and it means that system has got to go.
I'm sorry if you can hear my kid screaming. One last submitted audience question is from Janet. And Janet says, can you describe the role that Narcan should play in treating the opioid epidemic?
Put it directly into the community. Like, I have nothing personally against the PCCD, but they should not be handling naloxone distribution. That should be community-based organizations. And it shouldn't also be a part of the Sheriff's Association to distribute naloxone. Put it in the hands of the community, because research has proven when there is zero barrier access at a community level to naloxone, overdoses decrease and people don't die from a preventable death. So take it out of the stranglehold. Like, naloxone can't hurt anybody. We should be making it rain like Skittles around the state. So like, liberate the Narcan.
I'll also just mention that a lot of states and counties are using their money to buy naloxone and make it more easily accessible, especially places that are waiting to develop more comprehensive plans and do all that strategy that we talked about earlier with where federal funds are coming and where state funds are coming and how else can the settlement funds be used. In the meantime, a lot of places are using the money to buy naloxone because they already know it works. There are systems in place to distribute it, and they just know that there's more need for it. So it's sort of the quickest thing a lot of places are doing.
All right, great. Well, I think that's a great place to end on tonight. Thank you all so much. You can find more of our events at spotlightpa.org/topics/events, which Jasmine is posting in there. Thank you to all the panelists tonight. Thank you for everybody for your questions. Fantastic event. Really, I learned a lot tonight, and hopefully we can all stay in touch as we continue following this issue. So thank you.
Absolutely.
Thank you.
Good night, everybody. Thank you.
Thank you.